Okay. Our next speaker this evening is Stephanie Sabo. Stephanie is a registered respiratory therapist with over 10 years of experience in healthcare and a master's in healthcare administration. With that, Stephanie brings both clinical expertise and compassionate leadership to the field. With more than 5 years serving in rural health settings, she has developed a deep understanding of the unique challenges faced by underserved communities. Specializing in the care of patients with pulmonary impairments such as COPD and asthma, Stephanie is committed to improving respiratory health outcomes through patient education, evidence-based practice, and community outreach. Beyond professional practice, Stephanie is also a mother of 2 children with asthma whose care is supported through Medicaid, an experience that fuels her advocacy for equitable access to quality health care for all families. So please welcome Stephanie.
Thank you, everyone. Thank you for coming. Again, my name is Stephanie. I'm a registered respiratory therapist from Southern Illinois. I have worked in healthcare for over 10 years, and for the past 5 of them, I have served patients in a small rural access hospital. I am also a single parent of 3 children, 2 of them who have asthma and rely on Medicaid for their life-saving medications. Every day I see firsthand how critical programs like Medicaid, Medicare, and the Affordable Care Act are for families in our community. With these supports, many of my patients and even my own children would not be able to afford the medications and the care that they do need. Cuts of these programs just don't mean higher costs. They mean real people going without treatment, ending up in emergency rooms, and facing the impossible choices between paying for food, rent, or their health. I've had patients skip refilling their prescriptions such as their inhalers already because they had to pay for groceries. Right now, inhalers, the cost is still high, even with the Affordable Care Act. So, and those health care subsidies. I've seen families come in with children who are in respiratory distress because they can't afford preventive care. And I have watched patients to be remitted time and time again, not because their illness was untreatable, but because their coverage was unstable. These are not numbers on a spreadsheet, these are lives. When a rural hospital shuts down, the average drive to care increases by 20 to 40 miles, which for some patients is the difference between getting treatment and going without. I have seen patients right now that transportation, especially in this rural area, is a key issue. So trying to get to those specialty appointments, see those specialists, even for pulmonology, and that's already low. Pulmonologists are not very frequent around here. You have to travel to St. Louis or Belleville, or, there's one in Sparta, but they fill up quick and fast. So wait times are high. Our hospitals depend on Medicaid and Medicare funding to keep their doors open, pay their nurses and doctors, and also maintain critical service like ER care or even respiratory therapy care. Under respiratory therapy, we are considered an ancillary department, meaning that our department is fueled by revenue and volume. So we are definitely, whenever hospitals like to start cutting staff, your ancillary departments such as respiratory therapy, who are your key figures on managing that respiratory distress, health, COPD, asthma. We are a key player in that. You come into the emergency room and you have to be on BiPAP, CPAP, or intubated with a vent. We are the ones managing that. Those services will get cut, and then the nurses and doctors start having more responsibility on taking care of that patient, and they're already overburdened trying to take care of other nursing and other oh my gosh, I lost my train of thought. Sorry, other issues for that patient. It's a team effort whenever in the hospital setting. Everyone has their own set of responsibilities and to take care of the patient, and whenever you start cutting staff, that puts more burden on those doctors and nurses. If those resources are cut, we risk losing jobs, reducing services, and forcing patients, many of them who don't have reliable transportation, to travel hours for care. For someone in a medical crisis, that's just not an inconvenience. It can be deadly. I urge everybody, especially everybody urging their leaders, to remember that behind every statistic is a family, a child, a neighbor. Protecting Medicare, Medicaid, and ACA subsidies isn't just about numbers, it's about life-saving and supporting our communities. Every day, I am reminded that good breathing is about more than just lungs. It's about quality of life, connection, and the ability to thrive. I appreciate everyone coming. I appreciate everyone listening to my story in regards to that. Even with personally my own personal with Medicaid, I mean, I couldn't be able to afford the inhalers my children have if it wasn't for Medicaid. In regards to that, they would be more symptomatic than they are now. Asthma is a very difficult chronic disease that you live for the rest of your life to manage. So please, let's urge our leaders. Let's fight as a community. We are better, greater with numbers. So please, thank you.
Thank you, Stephanie.